When you count up all the rare diseases that affect children across New South Wales, it represents a huge number of children and where that's having a huge impact on their families.
By rare, what we mean is we're dealing with children who've got very complex conditions that not much is known about. And up to a third of children with rare genetic disorders don't even make it past their 5th birthday, because these are complex conditions that are hard to diagnose and hard to treat.
So as a group, it's probably the priority, if you like, for intervention to improve outcome and care.
What I think is fantastic is that Luminesce Alliance is giving us the opportunity to really understand how we can improve the diagnosis and care for these kids with rare genetic disorders.
I think what we can do in PPM3B is we can fill that space where referrals are made to our genetic service to help with diagnosis. Technology allows us to make many more diagnoses, which allows families and clinicians involved in their care to better look after those children and their families. The Gene to Care program is capturing everything we do in genomic medicine. The Gene to Care program is at initial referral and initial consultation. We enroll individuals into that program.
Ideally, my outcome would be to try to put as many children as possible on a pathway towards a diagnosis, or for children who already have a diagnosis, make them more present in the clinician's eyes in order to be filtered into a pathway for a potential advanced therapeutic, and to do this for as many children as possible.
We're getting now in excess of 150 samples, and that's steadily increasing. So if you compare from the beginning of the year to now, the samples have tripled in number. So there is a large need for diagnostic genomic testing and also research gene identification, and we're meeting that need in New South Wales Health Pathology. We really think it is important to train the next generation of clinical geneticists and laboratory geneticists, and the funding from Luminesce Paediatric has been instrumental in supporting that. We've had an extensive training program which has been supported from multiple sources, including Sphere and the NHMRC, and we're now at our 5th genomic trainee over the last 3 years.
Since coming to the laboratory here through the fellowship, I've learned about genomic analysis, about the technology, a lot of the sort of workflows and processes that the scientists and the pathologists go through to produce these amazing results.
What we have is we have on a regular cycle people with vastly different backgrounds and expertise coming into the department, spending 4 to 6 months here and contributing their expertise to us so that we get to know a little bit about what they do, whether it's from a counsellor background or a pathologist background or a clinical genetics background. And they in turn take away from us the sorts of rigorous structural thinking.
We're privileged to be, as far as I know, the only training lab in Sydney doing exome analysis and genomics.
Many of these children have a myriad of presenting symptoms that change over time and require the input of a range of subspecialties. The development of these technologies has enabled diagnosis. It has also enabled, and will increasingly in the future enable, new treatments, new drugs, and new care.
GeneAD is the name of our research study. It's short for Genomics for Additional Yield. It's for patients who remain undiagnosed after having genetic testing that's available in the clinical setting. Additional research methods can lead to a diagnosis in at least 10 to 20% more patients. And this is really important because a specific diagnosis can be the single most important step to accurately guide patient care and to aid family genetic counselling.
Genetic counsellors need to be based in clinical genetics because they themselves have their own professional development needs, and if they are based in clinical genetics, you get the team.
GeneAD will be the platform that brings together clinical and laboratory experts in genomics. It will use cutting-edge approaches for patient diagnosis and contribute to our understanding of rare genetic disorders. We're excited to collaborate with the Broad Institute, a world-leading centre in genomic sequencing and analysis, and the groups led by Professor Sandra Cooper and Dr. Lisa Riley at the Kids Research Centre.
genetics is a family affair. And it's not only the care these children need, but of course the implications for them, for their siblings, and for other relatives that the families are dealing with at the same time.